the heck is wrong with you?
I'm just trying to loosen up my shoulder. I'm getting excited about spring training, although maybe
If it happens.
if it's not a spring training, but baseball season is really always starts in February, and I played a lot of ball, and just getting the thought of back throwing out there, but it's a tough time of year. It's cold out here in the Northeast, and the shoulder's kind of stiff.
Hi everyone, Dr. Timothy Gallagher.
Dr. Michael Marciello.
And we're from Maragal Medical. We kind of share some, history with our shoulder injuries. I too, a tennis player, suffered a really bad shoulder injury. And at our clinic, we really have a unique approach when it comes to, diagnosing and managing patients with shoulder pain. So why don't we talk to the group about, the different causes and some of the different things that we can do for patients with shoulder pain.
Well, shoulder pain is vast because we have a lot of connections to the muscles around the shoulder. So a lot of people come in with a complaint of neck pain, but really it's their shoulder that gives them problem, and it gets tied up in the trapped muscle that refers to the neck. So we have to make sure we always think about shoulder when a person is complaining of neck pain. But when we get truly to the shoulder, there's all these group of muscles we all call the rotator cuff. And what does that mean? Well, a group of muscles that allow us to rotate or really go through this full range of motion. Well, they can break down, they can get inflamed, they can have tendonitis, they can have tears, a partial tear, or even a full thickness tear.
Sure.
That results in weakness, that results in decreased range of motion, and of course pain. So we have to look at all those factors in relation to when we assess how to get someone back moving in regards to a shoulder problem.
Right, and I think at our clinic it's so unique. We really utilize this team approach where, our medical director, Dr. Marciello, has the ability to make a real accurate diagnosis and order the appropriate diagnostic testing like an X-ray or an MRI. And then all of the chiropractors in the clinic are going to focus on getting that range of motion back into that joint. And then our all-star physical therapist, my wife Colleen, is going to make sure she goes through the appropriate home exercises to make sure she's strengthening those weaker muscles or stretching out those tighter muscles. But in terms of actual treatment, the most common, we talk about this all the time, is you go to the orthopedist and you get a cortisone shot. And why is that bad for the shoulder?
Well, we have to really be concerned about too much cortisone because cortisone weakens the tendons, weakens the tissue that it gets injected. So if you've got a little bit of a frail or kind of a partially weakened rotator cuff muscle or one of the tendons in there, and you get a cortisone injection, you may actually be causing a chance for it to fully tear or break through. So we really don't want to rush to, again, an injection to kind of treat. We can start with simple things. Icing, of course, taking relative rest, building up our tolerance and exercise strengthening, but we may use ibuprofen just to start. We may use some simple rest and ice. But we don't want to go to cortisone. We'll get a picture, we'll get an MRI many times, we'll see this inflammatory tissue, sometimes called bursitis or tendonitis, and just got to refrain from that injection. If you're slowing down your ability to get back and throwing or doing your preparation for the spring season, just go cautiously and slow. Don't jump to the injection.
Yeah, and certainly, make sure that you get an appointment with Dr. Marciello. He's lived it. I myself have lived it as well. And if we're talking about injection therapy, we can utilize some more conservative injection therapy like a PRP injection, a regenerative medicine injection that we call an umbilical cord allograft injection. And those two injections are designed to help repair the damaged tissue. But we also do some intramuscular injections, and instead of using the cortisone, we actually use this natural product called Serapin, which is plant-based. Totally has the ability to help relax the muscle, but more importantly, doesn't have the side effects that the cortisone does. And of course, the class 4 laser works really good to accelerate the healing. So if you're suffering from shoulder pain, or if you have somebody that that is complaining about pain in the shoulder, please don't hesitate. Give us a call here at Maragal Medical. We take most insurances, and let Dr. Marciello go through and make sure you get an accurate diagnosis, and we'll make sure we list out all of the treatment options that you have. And then one last thing, Dr. Mike, we've got this great robotics technology called Hanova. We're still offering to the public those complimentary fall prevention screenings. You can come to the office completely free of charge, and for 20 minutes, we'll take you through the testing. We'll be able to identify if you're at risk for fall, and then most importantly, we'll give you the chance to book an appointment with Dr. Marciello so he can figure out actually what's causing your risk for fall as well. More information can always be found on our website at maragalmedical.com, and you can certainly find more information about our fall screening by clicking on the link below. So that's it for today. Again, my name is Dr. Timothy Gallagher.
Dr. Michael Marciello.
And we're from Maragal Medical. We'll see you soon, everyone.
Bye now.